Welcome. I'm Phil English. I'm National Coordinator of the Healthcare Group Purchasing Industry Initiative, or HGPII. HGPII is a national membership organization constituting most of the group purchasing organizations that in turn support most of the purchasing that occurs in acute care and also much of what is done in long-term care in North America. In the process, we oversee group purchasing that's responsible for important decisions that involve quality, cost control, and also innovation in the healthcare sector. At a time when there's great concern about our healthcare system, our members are important partners with healthcare providers to make sure that the healthcare supply chain is predictable, ensures quality, and also controls costs. This is a very important function, and we're proud of the fact that for the last 11 years, we've had an opportunity to oversee this system. In recent years, our team has taken over HGPII and has expanded its activities. Our 11th annual report, which is now available, details some of those activities and how the industry has changed. The GPO industry in healthcare has undergone significant consolidation and has had to pick up significantly more of the burden of making sure that healthcare providers like hospitals have access to the important inputs, the healthcare supply chain that they need in order to provide services to patients. What we do is we offer them choices, and HGPII oversees our members to ensure that they make the commitments necessary to ensure ethical activity, the highest quality, and the control of costs. HGPII is an organization that insists on transparency in the healthcare system and consists of member organizations that are committed to the HGPII principles. Those include a written code of conduct, a trained personnel, and we work with them to train their personnel every year, quality and cost effectiveness within the supply chain, open competitive purchasing without conflicts of interest, and also participants have to be involved in an annual seminar, which we have in Washington every year. We also insist on accountability to the public. We're here to certify that every one of our member organizations has met those standards and has done so in a public way that permits the consumer at all levels to oversee the process. What HGPII is doing is overseeing a GPO industry that has been in existence for 100 years, providing benefits, including quality for patients, cost savings and variety for providers, fairness for vendors, and value for the entire healthcare system. The HGPII process is very straightforward. We circulate among our members a mandatory questionnaire, and we publish the results. We follow up the questionnaires every year with interviews, and we also conduct an annual training seminar. As a result of that, we are able to certify the policies and internal controls of each of our individual members. And then we provide for full disclosure of our findings on the internet and in the public. Our annual report coming out this year is the best survey system-wide and economy-wide of the GPO sector. And it's used by analysts and also policymakers to make important decisions about how to proceed in healthcare. In general, what we've found this year is that there have been steady improvements in the way that GPOs do contracting. We're able to certify that they're meeting very high standards in bidding and in procurement. They each have a code of ethics that they enforce and that they share actively with their employees. They are each restraining their fees and also promoting new products. And we're able to say that each one of these organizations has been taking strides to develop a culture internally that encourages ethical decisions and best practices. We believe there are also some new developments in the industry that we're going to flag this year. One of them is there are significant improvements in the efforts by our individuals to provide diversity within the healthcare marketplace. Most of our members and many of our biggest members have been redoubling their efforts to reach out, identify, highlight, and encourage and support diverse providers of healthcare services, whether they're minority-owned, veteran-owned, or women-owned. We believe that our members are moving mountains to provide access to these sorts of vendors to hospitals that want to be able to quantify how they are benefiting diversity within their community. We're anticipating that HGPII's role in this process is going to be increasing in coming years, and we are strongly committed to coming up with the best way of framing best practices to encourage this activity. We're also finding that the GPO sector is not only accommodating new technologies, but actually encouraging new technologies. We're finding that many technology-oriented startups are benefiting from GPOs reaching out to them and giving them a network that they can enter, in many cases with modified contracts on short notice, allowing them to sell their products without always having to have a large sales force. We believe this is promoting technology within the healthcare sector in a very, very positive way, and we have found that our membership, big and small, are increasingly and committed to be technology friendly. We're also finding that our members are very committed to expanding their efforts in the area of sustainability. What I mean here is that more and more GPOs are making a commitment to be able to offer their member purchasers a range of products that specifically provide for a sustainable environment and quantifiable community benefits. Last year, for the first time at our annual seminar, we had a forum on sustainability. We're doing that again this year, and we are encouraging each of our members to look for creative ways to provide the healthcare organizations that they service wonderful opportunities for more sustainable products and to harness the healthcare purchasing to encourage sustainability in a positive way in communities throughout the United States. We think this is a very important but quiet frontier that can be pursued to great benefit. In a nutshell, this annual report by HGPII provides a rare window on how an important part of the healthcare marketplace is working and also testifies to the benefits of a culture of ethical best business practices that encourages broader visions for how to do purchasing and provides the organizations that have patients with affordable quality services that also make a difference in the community. We think that the net result is that HGPII is making the case for an important part of the healthcare system to do self-regulation and show real results that can be a model for similar activities elsewhere. We're very excited to be able to work with the public. You know that on our website, you can reach out to us at any time if you have questions. You know how to reach me if you go to our website. And we welcome the opportunity to take questions, to talk about the healthcare group purchasing industry initiative, and also what healthcare GPOs are doing. We also encourage every citizen and every vendor to be aware of the information that we provide and also the remedies we offer if they run into practices and they run into activities that don't meet our standards. We are enlisting everyone in the healthcare universe to work with us to try to provide the best possible healthcare system by managing the healthcare supply chain. Thank you, and I look forward to working with you.